Welcome to the 9th topic in our series for families, titled Comfort Care. At times during the caregiving journey, family caregivers will need information on future care for their loved ones. The goal of our presentation today is to provide information on experiences with comfort, palliative and hospice care, and other tips for providing comfort care to a person with dementia. Let's start by remembering that the focus of this training series is about working as a team to create a partnership between family members and a variety of healthcare providers that help you care for a loved one with dementia. Partnerships rely on good communication. It also means asking questions or for explanations if something the provider says doesn't make sense to you, as well as bringing up any concerns that you may have with the care routine for your loved one. Being prepared throughout your conversations and interactions with providers is also important to a successful partnership. When we talk about comfort care, we focus on the holistic approach to providing care by looking at multiple domains, including physical, mental, emotional, and spiritual. Let's spend some time discussing each of these in a little more detail. Physical experiences that can cause a person pain or discomfort include some of the things that you see here, including constipation, nausea, dizziness, feeling too hot or too cold, headache, cramps, and shortness of breath. One goal of comfort care is to actively look for and address signs of physical experiences when the person may not be able to communicate their discomfort. Now let's take a closer look at mental experiences. Mental experiences addressed in comfort care include prolonged sadness, anxiety, depression, restlessness, and fits of rage, among others. Mental experiences may be a result of physical discomfort or another form of discomfort, and can negatively affect the person's quality of life if not addressed. Now that we have discussed physical and mental experiences, let's talk about emotional experiences. While emotional experiences are common in dementia care, it is important that they are not overlooked. Emotions may include being short-tempered, feeling isolated and lonely, feeling misunderstood, feeling judged, and feeling overwhelmed, as well as the ongoing process of grieving each loss as it occurs. Let's take a minute for a discussion breakout. Regarding emotional experiences, what are some difficulties that you have faced as a caregiver? Please pause the presentation now, and then, when you are ready to continue on, press play. Finally, we will touch on spiritual experiences. Spiritual experiences differ for each individual, but may include seeking a sense of the meaning of life, meaning for the illness experience, trust, a connection to something larger, or a sense of deep belonging. Bringing a sense of awareness to these needs for both the family caregiver and for the person with dementia is the first priority of comfort care. The dementia journey is difficult. The goal of providing comfort care is to turn a difficult experience into comfort. Your healthcare providers have learned a lot along the way, some of it from working with other patients. If they don't have the answer, they can look for it or provide you with a referral to someone who can. Talk with people in your support group about solutions that may have worked for them, and keep in mind that often there are practical solutions for many types of pain and discomfort. The key is to speak up and be assertive about your experiences. When we are talking about providing comfort, we want to note that finding comfort is important for everyone in the dementia journey. That includes the person experiencing the dementia, as well as the people caring for the person with dementia. Comfort is critical for stamina, health, quality of life, hope, and dignity. There are two main types of comfort care that we will discuss today: palliative care and hospice care. If you are not familiar with palliative care, it is care that seeks to alleviate pain, care that addresses uncomfortable symptoms, care that is appropriate throughout an illness, not just at the end of life, and care that relies on the idea that a person's comfort should always be of concern to healthcare providers. It seeks to keep the idea of comfort at the forefront of discussions and decision-making. While all healthcare providers are capable of providing some level of palliative care, there are some providers who specialize in comfort awareness and measures. If you do not feel that your or your loved one's comfort care needs are being met, ask about a palliative care specialist. Keep in mind that most hospitals have palliative care specialists available. Now that we have introduced palliative care, let's talk a little more about hospice care and how it differs from palliative care. Hospice care resembles palliative care in that it is care that is aimed at providing relief from uncomfortable symptoms. Where hospice care differs is that it is care for those who are no longer pursuing a cure or treatment of the condition. It is available for those who have a life expectancy of 6 months or less, according to the physician. Hospice care is a Medicare benefit and paid by Medicare, although most other insurance plans also provide hospice coverage. The number one suggestion heard from individuals and families who receive hospice care for a loved one is that they wish they would have begun hospice care sooner. Many don't realize how helpful, supportive, and comforting the services can be through the caregiving journey. Let's take a little time for a discussion breakout to talk about any questions that you have regarding hospice care. If you have experienced hospice care for a loved one, please share your experiences now. Please press pause, and then, when you are ready to continue, press play. Now that we have discussed what hospice is, you may be wondering, who provides hospice care? The answer is hospice organizations with staff that are specially trained to help individuals and families through the end-of-life journey. These groups may be hospital-based or standalone organizations. They have a wealth of information on resources, ideas, and supplies that bring comfort to the person as well as the family caregivers. They also help to provide training and support to providers and other caregivers. Another common question is, where can hospice care be provided? The answer is anywhere that the person and/or family prefers, whether it be in a hospital setting, in a nursing home, or in a private home. Hospice staff members are available 24 hours a day, 7 days a week. Help and support are just a phone call away. We want to briefly highlight videos that display stories of how hospice has assisted others. This link will be available in the resource section of the website. Please be sure to spend time watching some of these videos after this presentation. Hospice services are based on the needs of each individual and each situation, but some of the services can include volunteers to spend one-on-one time with you or your loved one, a nurse and physician to oversee the care of your loved one and consult with other providers, support services such as a social worker, chaplain, music therapist, physical therapist, and home health assistant. supportive medical equipment, medications, and supplies, and also bereavement support for the family for up to a year following the death of their loved one. This figure shows that after a person receives a serious diagnosis, care aimed at prolonging the person's life, in light gray, is provided, along with care aimed at providing comfort, the dark gray. Over time, options for life-prolonging treatments become limited, and the focus moves to providing comfort. Both palliative care and hospice care are aimed at paying close attention to treating pain and discomfort. Palliative care is an important part of overall care throughout the patient's life. Toward the last months of life, many people transition to hospice care. With hospice, the aim is to alleviate pain and uncomfortable symptoms. Here are a few words and phrases family caregivers used to describe their end-of-life experience with hospice care. For our final breakout today, we want to provide advice that family caregivers wanted to share with others regarding end-of-life comfort care. Start the habit of noticing signs of discomfort or pain in your loved one. Share these observations with the nurse or physician. Ask your healthcare provider about hospice care. Talk with others about their experiences with local hospice organizations. We also want to stress awareness of your own pain and areas of discomfort. Seek treatment to allow care for yourself. Your comfort is important, as pain or discomfort can add to caregiver exhaustion. It can be helpful to make a list of the ways you care for yourself to refer to in the future. To wrap up today, we will leave you with a few keys to keep in mind. Be aware of and work to understand your loved one's experiences. Be open to talking with providers about palliative and hospice care. Try to focus on creating a good experience for your loved one by focusing on comfort measures. And don't forget to take care of yourself. In our final presentation, we'll discuss changing goals of care throughout the dementia process. We hope to see you soon.